In what ways does vitamin D support prostate health specifically? Some studies suggest that adequate vitamin D levels could reduce the risk or severity of prostate cancer. In this video, we will explore the importance of vitamin D levels for overall health, including prostate health. Benefits of vitamin D. Number 13. Enhances effectiveness of prostate cancer treatments. Vitamin D can enhance the effectiveness of prostate cancer treatments such as radiation and chemotherapy. It sensitizes cancer cells to these treatments, making them more effective at lower doses. This can reduce side effects and improve the overall outcomes of prostate cancer therapies. Number 12. Reduces prostate inflammation. Vitamin D has potent anti-inflammatory properties that can reduce inflammation in the prostate gland. Chronic inflammation is a risk factor for prostate cancer and benign prostatic hyperplasia, BPH. By reducing inflammation, vitamin D helps maintain a healthy prostate and reduces the risk of related conditions. Number 11. Supports hormonal balance. Vitamin D plays a role in maintaining hormonal balance, which is crucial for prostate health. It regulates the levels of hormones such as testosterone and dihydrotestosterone, DHT, which can influence the growth of prostate tissue. Balanced hormone levels help prevent the development of prostate disorders. Number 10. Improves urinary function. Adequate vitamin D levels can improve urinary function by reducing the symptoms of BPH. It helps relax the muscles in the prostate and bladder, reducing urinary obstruction and improving flow. This leads to better urinary health and comfort for those with prostate issues. Number 9. Boosts immune system. Vitamin D plays a crucial role in enhancing the pathogen-fighting effects of monocytes and macrophages, white blood cells, that are important parts of your immune defense and decreases inflammation. This helps the body to fight off infections more effectively, reducing the risk of chronic illnesses. Number 8. Improves bone health. Vitamin D promotes calcium absorption in the gut and maintains adequate serum calcium and phosphate concentrations to enable normal bone mineralization. It helps to prevent rickets in children and osteomalacia in adults. Along with calcium, it also helps protect older adults from osteoporosis. Number 7. Supports heart health. Adequate levels of vitamin D are associated with a lower risk of cardiovascular diseases. Vitamin D can reduce arterial stiffness and improve endothelial function, which enhances blood flow and reduces the risk of heart disease. Low levels of vitamin D have been linked to an increased risk of hypertension and heart attacks. Number 6. Enhances mood and mental health. Vitamin D receptors are present in many parts of the brain, and vitamin D affects the proteins involved in brain function. It is believed to play a role in regulating mood and warding off depression. Low levels of vitamin D are linked to an increased risk of depression and anxiety. Number 5. Reduces risk of type 2 diabetes. Vitamin D improves the body's sensitivity to insulin, the hormone responsible for regulating blood sugar levels. It also helps regulate the release of insulin, thus contributing to better blood sugar control. People with higher vitamin D levels have a lower risk of developing type 2 diabetes. Number 4. Supports muscle function. Vitamin D is essential for muscle function, as it promotes the absorption of calcium and phosphorus, which are necessary for muscle contraction. It helps maintain muscle strength and reduces the risk of falls and fractures, particularly in older adults. Vitamin D deficiency is linked to muscle weakness and pain. Number 3. Promotes healthy pregnancy. Adequate vitamin D levels are important for both the mother and the developing baby during pregnancy. It reduces the risk of complications such as preeclampsia, gestational diabetes, and preterm birth. Vitamin D also plays a role in the development of the baby's bones and immune system. Number 2. Reduces risk of multiple sclerosis. Multiple sclerosis, MS, is more common in people who live far from the equator, where there is less sunlight. Adequate levels of vitamin D, which is synthesized from sunlight exposure, are believed to reduce the risk of MS. Vitamin D's anti-inflammatory properties help in modulating the immune response in MS. Number 1, supports lung function. Vitamin D is involved in the growth and development of lung tissue and has anti-inflammatory and antimicrobial properties. It helps in reducing the risk of respiratory infections, chronic obstructive pulmonary disease, COPD, and asthma. Adequate vitamin D levels can improve lung function and reduce exacerbations in people with asthma and COPD. Sources of vitamin D. Natural sunlight is a highly accessible source of vitamin D for many people. Between 5 to 30 minutes of sun exposure during the brightest hours may offer sufficient vitamin D, although excessive sun exposure can increase the risk of skin cancer. Other sources include fortified dairy products like milk and yogurt, fortified orange juice, fortified cereal, beef liver, egg yolks, which have small amounts of vitamin D, lean meats, nuts, seeds, and fortified margarine. Additionally, dietary supplements can effectively elevate vitamin D levels. The recommended daily intake of vitamin D for males aged 50 to 70 is 15 micrograms, mcg, or 600 international units, IU, while for males over 70 it is 20 mcg or 800 IU. Vitamin D is essential for maintaining various aspects of overall health, including immune function, bone health, heart health, mental health, and more. It plays a significant role in reducing the risk of chronic diseases and enhancing quality of life. Ensure adequate vitamin D levels through sun exposure, diet, and supplements if necessary. Do not forget to subscribe, share, and comment.